6.
Good evening once again. We begin with an in-depth look at a unique approach to keep kids in school as COVID cases soar among children. Since July, there's been a 240% increase in weekly COVID-19 cases among kids. That's according to data published recently by the American Academy of Pediatrics. Here at home, Erie County health authorities say the highest COVID-19 positivity rates are in people under the age of 19. The 5 to 10 and 14 to 17 age groups both had a positivity rate of more than 6% for the week ending September 18th. Now, under current guidelines, any student who comes into contact with someone who tested positive must quarantine, but some states believe they have found a solution to keep kids in the classroom. California, Illinois, Kansas, and Massachusetts are using what's called the test to stay model. Tonight, all new at 6, senior reporter Eileen Buckley explains what the test to stay model looks like and why many parents want to see it used here in New York.
And it's being used as a tool to keep healthy kids in school, which is fantastic.
Clarence school parent Taria Parsonen is with the Western New York Education Alliance, fighting to keep kids in the classroom as the COVID pandemic continues. The organization has sent this letter to Governor Kathy Hochul, asking her administration to take a different approach to end school closures and quarantines of students and adopt the test to stay approach.
So what test to stay would allow to happen is for the kids to take a rapid test, and if they are asymptomatic and produce a negative for a series of days, they're allowed to remain in school.
Schools in Erie County must follow the recommended quarantine policy from the county health department. Right now, if 2 students test positive for COVID, a whole classroom is shut down, even if other students weren't in close contact, and those students can be quarantined for up to 10 days. Parsonen says Erie County's quarantine rules are more restrictive than guidelines laid out by the CDC and New York State.
There just can't be an excuse to keep schools closed for the 3rd year in a row. Too much damage has been done to the kids.
It's important to note that this particular process is presently not recommended by the CDC.
Dr. Thomas Russo is an infectious disease specialist at UB's Jacobs School of Medicine.
There's a very specific importance when you quarantine people.
Decisions such as who to quarantine and what processes are involved are handled at the state or potentially at the county public health level. So the state has the ability to make that decision if they want to implement such a plan.
Dr. Russo tells me test to stay is an interesting concept, but comes with logistical challenges.
You need to have the availability to be able to do these rapid tests on a daily basis. And obviously, someone needs to pay for these tests, which may or may not be possible depending on the school system.
If there is a lack of funding or inability to procure rapid testing, Western New York Education Alliance stands ready to help that process.
And Eileen joins us live tonight. Eileen, interesting concept here. How is Erie County supporting schools at this point?
Well, Jeff, the Erie County Health Department says it is working closely with schools on testing, taking random samples of 10% of unvaccinated students and staff, and for those who were in classrooms where there was a positive COVID case. Jeff?
All right, our Eileen Buckley reporting live tonight.